Why is COVID-19 hitting some communities harder than others? And who exactly has been hit hardest? We're seeing this happen across the country. But to better understand the divide, we zeroed in on two New York City boroughs, the Bronx and Manhattan. Even though Manhattan has more people, the Bronx has more cases and more deaths. We wanted to understand the reasons for this gap, so we compared the boroughs based on three criteria: why more people are getting infected, being hospitalized, and dying from COVID-19. And it's revealed this pandemic is attacking two very different Americas. Let's look at why there's a difference in infection numbers between the two boroughs. We'll start with income. The Bronx is the poorest borough in the city, with a median income of $38,000, compared to Manhattan's $82,000. Almost 60% of people in the Bronx are paying more than they can afford for housing, which has led to more multi-generational housing in the Bronx and more residents in public housing than any other borough. For every apartment in the Bronx, there are 2.8 people living in it. Compare that to the 2 people living in every apartment in Manhattan. More people at home likely means more people get sick. Overall, there's 350,000 more housing units in Manhattan than the Bronx, and better quality housing. See this map? Most residents in the Bronx are dealing with maintenance problems, like leaks, rats, cracks, plumbing, and broken toilets. These issues alone make it more challenging to live at home, not to mention having to work from home because of COVID-19. That is, if you can work from home. According to the U.S. Bureau of Labor Statistics, of those Americans making less than $33,000 a year, which are these neighborhoods in the Bronx, 9% of people could work from home. Whereas of those people making more than $79,000 a year, all of these neighborhoods in Manhattan, 60% could work from home. On the other hand, in the Bronx, residents who can't work from home are most likely out of a job and tight on money, or they're essential workers. Think grocery store clerks, transit employees, trash collectors, healthcare workers, many of those people you see daily out on the front lines. 17% of frontline workers in New York City are coming from the Bronx, while just 12% are from Manhattan. And for the majority of these essential workers, getting to their job means taking the subway. Subway ridership has dropped across the city, but not by the same amount. In Manhattan, 75% fewer people are riding, but in the Bronx, ridership has dropped only 55%. So trains to and from the Bronx can be packed, especially with reduced subway services. Plus, people from the Bronx face longer commutes than people in Manhattan, on average 12.7 minutes longer, of standing body to body with that person who's maybe coughing. Okay, let's move on to the second criterion. Let's say someone in each borough does get the virus. What will influence whether they become hospitalized? The Bronx has had over 10,000 hospitalizations. Manhattan, about 6,000. Every year, New York counties are ranked based on their health. Last year, Manhattan was 6th best in the state. The Bronx, dead last, out of 62 counties. This is based on things like access to clinical care, the environment, and pre-existing conditions. The Bronx has higher rates of pre-existing conditions like asthma, heart disease, and obesity, conditions that increase the risk of a severe COVID-19 case. To explain why this is, we're going to have to go deep. We'll start with obesity rates between the two boroughs. Studies have shown that poor diets and lack of exercise are linked to obesity. And in the Bronx, families facing money problems or limited time are forced to turn to cheaper prepackaged foods. 87% of kids in the Bronx rely on free or reduced school lunches, which are packed with salt and fat. Plus, the Bronx has almost double the amount of food stamps per individual compared to Manhattan. But the greatest contributor to diet, though, is access. And the Bronx has historically had some of the worst food deserts in the country, where it's hard to find affordable and healthy food close to home. All of these factors have created a lack of healthy resources for generations in the Bronx. They lead to unhealthy eating habits and high rates of obesity and diabetes, both pre-existing conditions that increase your risk of death from COVID-19. On the other hand, in Manhattan, life expectancy and access to healthy food is much higher, People not only have more access to grocery stores, they also have more gyms to choose from. Simply put, these things and disposable income make it a lot easier to be healthier here. Another pre-existing condition that skyrockets risk of COVID-19 hospitalization: asthma. In big cities, studies have shown pollution is a major cause of asthma. Pollution is bad across New York City, but the Bronx has the highest rates of asthma-related emergency room visits. There's even a place nicknamed Asthma Alley in the South Bronx. It's surrounded by 4 highways and sanitation and sewage facilities. There's also a bunch of trucks coming and going from all of these distribution centers. These food wholesalers and the Fresh Direct Distribution Center here, and the Wall Street Journal and New York Post printing press here. At last count, asthma hospitalizations were 27 times higher in this area than the rest of the city. Bad asthma equals a higher risk of being hospitalized with COVID-19 and needing a ventilator to help you breathe. But it gets worse when you take into account how accessible medical professionals are in these areas. In Manhattan, there's 1 physician for every 750 people. In the Bronx, there's 1 physician for every 1,770 people. There are also fewer hospital beds in the Bronx. Manhattan has almost double the amount of hospitals for only a 15% larger population. That brings us to our third and final criterion. Why are more people dying due to COVID-19 in the Bronx? In Manhattan, 4 emergency hospitals were constructed to combat coronavirus. While the Bronx was promised one, the borough hasn't gotten it yet. Quality care also isn't as accessible in the Bronx. On average, Manhattan hospitals received 3 out of 5 stars. Bronx hospitals received 1.2 out of 5 stars. Jacobi Hospital in the Bronx is one of the 5 worst-rated hospitals in the nation. Add in the effect of pre-existing conditions we talked about earlier, and the Bronx has had 2,800 deaths of people with underlying conditions. Manhattan, almost 1,300. Altogether, as of May 10th, Manhattan's death toll was 1,946, while the Bronx hit 3,177 deaths. And when you break down New York City's death toll, people of color are 2 times more likely to die of coronavirus. In the Bronx, the population is 85% Black or Hispanic, whereas in Manhattan, 64% of the population is white. This is why you're seeing headlines that a disproportionate number of people of color are dying of COVID-19. But these deaths go beyond coronavirus. For the Bronx, cycles of income inequality, food deserts, poor healthcare, fewer hospitals, and crumbling housing have harmed communities of color for generations. And we see this pattern repeat itself again and again, with Black and brown communities across the country: Baltimore, Detroit, Chicago, St. Louis, Los Angeles. This disease is not the great equalizer. Yes, anyone can get COVID-19, but not everyone is as vulnerable to dying from it. That has everything to do with the problems in place long before this ever started.